Happy Friday, boys and girls. Today, on this wonderful Friday, we're going to rip you out of fantasy for a little bit and touch back into a nonfiction article just to make sure that your annotating skills stay, stay good, that you don't get rusty kind of thing. So Ms. Stollenwerk and I thought it would be a good idea to read about a current event that some of you may have heard about. I'm just saying.
Why not read about the coronavirus?
And then we're going to practice annotating, and then we're going to challenge you to take this quiz. This article has been assigned to you as of this morning, so you should have no problem accessing this. If for some reason your teacher doesn't normally use assignments, and you're unsure, all you need to do is go to the search bar and just type in this title, "Why Everything is Closing for Coronavirus," and it'll pop up, okay? You don't even have to type in the entire title. So what we're going to do today is I'm going to read through. Notice I've dropped my Lexile because if I'm practicing annotating, I don't know if you can see it, boys and girls, I dropped to 570 because when you're just strictly practicing annotating and note-taking, sometimes it's easier to do it in an easier text, and then I can build that skill from there. So, without further ado, this is Why Everything is Closing for the Coronavirus. It's called Flattening the Curve. And as a reader of nonfiction, I'm always going to orient myself to the text and look at all the pictures and captions as well, so I can prepare myself for what I'm going to be learning about. So this image caption says, Image 1, authorities control a line of motorists waiting to be tested for the coronavirus at Glen Island Park in New Rochelle, New York on March 13th, 2020. Closing areas such as parks is an essential part of social distancing needed to slow the COVID-19 outbreak. Okay. So here we go. Just scroll here. So I'm going to read, and Ms. Stollenwerk is going to model parts that would make sense to stop and annotate on the side so that I just deepen my understanding and clear up any clunks or things that I might be unsure of. Schools have recently been shutting down all over the country. They are moving to online instruction. Some sporting events are being canceled. Other sporting events are being delayed. In the 2020 Summer Olympics are supposed to happen in Japan, but the Olympics' future is not clear. Some festivals and conferences are also being canceled. Others are being delayed.
Ms. Brzezinski, I would stop there and I would do an annotation and I would kind of list what's closing or being shut down. Okay. So in those 3 paragraphs, we saw schools.
So I can just highlight anything.
Yep, schools, sporting events.
Ms. Stollenwerk, what color do you choose?
I always like to start with the first color. So I like to start with yellow for my first highlighting. Okay. And then when I switch to a different subject or topic, I switch my color.
Okay, so I'm just going to list the things that are being closed.
So we have schools, sporting events, possibly the Olympics, but we don't know for sure yet. And then festivals and conferences.
All right. So I have just basically made sure that I comprehended exactly what's being closed so I can move on. A lot of times it's just easy to get lost in your nonfiction. You're just benchmarking yourself here. So the cause for all these closures is COVID-19. It is a flu-like illness. COVID-19 is short for the coronavirus disease 2019. It began in China and it's been spreading across the globe since December 2019. there have been around 1,660 cases of COVID-19 diagnosed in the United States. There have been fewer than 50 deaths because of it.
Now, in those two paragraphs, we learned quite a bit about COVID-19, so I would probably do another annotation.
Okay. So I'm going to change my color here.
Yep.
Okay.
So we learned it's kind of like the flu.
It's kind of like the flu.
It began in China in December of 2019. And we also learned how many cases there have been and how many deaths it has caused.
Okay, so I'm just going to write a little bullet point for that. I'm just going to highlight the number. I don't need to just retype the number. I can just note to myself number of cases and deaths. Okay, here we go. So serious spread. All the closures are costing money. So are the delayed events. Still, sporting events and businesses are being canceled. This shows how serious the spread of coronavirus is. Health officials are telling people to not gather in groups. This helps prevent the spread of the virus.
Okay, so I feel like this paragraph right here is kind of explaining why these things are being delayed or canceled. So health officials are canceling possibly the Olympics, schools, concerts, because they don't want people to gather in groups.
Because
people aren't in groups, they can't spread the virus as easily.
Okay, and I can just say virus won't spread. You know what I mean. Okay, so let's keep going. Good job, Miss Nollenwerk. You're really doing a great job of annotating today.
Thank you, Mrs. Mrozinski.
Many people talk about the flu. Every year, the flu makes millions of people sick. It kills tens of thousands of people. The flu is expected to make 50 million people sick this year. That is just in the United States. It is expected to kill as many as 52,000 people.
So right there, I think we learned a lot about the normal flu. So I would probably do some highlighting and kind of be thinking about how the flu is different than the coronavirus so far.
So how the flu is different. What would you say, how is it different, Ms. Nollenwerk?
Well, I know it says right here that every year the flu makes millions of people sick. So far, we don't have millions sick from the coronavirus. Hopefully that doesn't happen. And it also says that this year, in just the United States, the flu can kill up to 52,000 people.
I'm going to say could possibly kill up to 52,000 people. All right. Here we go. So why is everyone making such a big deal about coronavirus? Why are events being canceled? Why are classes being moved online, especially when there are so few cases right now? There's a good reason to cancel everything. The goal is to slow down the spread of the virus. This will also make sure people who do get sick can get treated. If someone gets coronavirus, they have to go to the hospital. If a lot of people get sick at the same time, the hospital will get full quickly. Too many people can't get sick. There's not enough space in hospitals. This is what's happening in Italy.
So I think this is a really important paragraph because it's talking about why we're kind of keeping to ourselves a bit and canceling school, why we're telling people not to go out as much, because if a lot of people get sick, or if anyone gets sick, they have to go to the hospital. And that could overrun the hospitals. The hospitals won't have enough beds or staff, possibly.
So lots of people getting sick would overrun the hospital, and people might not receive treatment. Well, if Ms. Brzezinski could spell.
That's okay, Ms. Brzezinski. You should see me when I do this in my classroom.
Okay. So we know some more of the why. If people only get sick a little at a time, it's better. That's why, that way hospitals can take care of them. It's more manageable. This is called flattening the curve, and this is how it looks when you draw it out. So if y'all can see what it means to flatten the curve, I can look time since the first case. Here's my first outbreak. The daily number of cases. This says peak number of cases with no protective measures taken. Protective measures, including hand washing and social distancing, can reduce how fast the virus spreads and how many people get it. This can prevent overburdening the healthcare system. So right here, if with social distancing and proper hand washing, this would be the peak number of cases with protective measures taken, This can change depending on the amount of resources and healthcare professionals are available. So, always reading my captions as well. Image number 2 that we just talked about. You probably can't see this little writing. It says what it means to flatten the curve. The peak on the left represents the number of COVID-19 cases if no protective measures are taken, such as hand washing and social distancing. Protective measures can reduce how fast this virus spreads over time, hopefully preventing hospitals from becoming overburdened. The capacity of the healthcare system can change depending on the amount of resources and healthcare professionals available. All right, you guys are doing great. Keep it up, Ms. Stallenwerk. Epidemiologists study diseases. They try to predict how diseases spread. They look at how the disease behaves. If everyone acted like normal and did not limit social interaction, the number of cases would increase. The number of people infected would grow very quickly. They would overwhelm hospitals. This will result in more people dying. This is happening in Italy. There are not enough hospital beds or medicine for everyone who is sick. There aren't enough healthy doctors and nurses to take care of everyone at once.
So Ms. Brzezinski, I think this is a really important word right here that we should maybe take some extra time to think about.
Okay.
So, epidemiologist.
That's definitely a clunk.
What is an epidemiologist? So if we look back, we know that it sounds like a scientist. They study diseases, try to predict how those diseases will spread, think about how a disease behaves. So an epidemiologist is probably really important in kind of telling us how we should act or behave to try to limit the spread.
Okay, so epidemiologists are scientists that study diseases. Okay, so I don't want to go over, brush over that. Anything else we want to annotate in this article or in this paragraph of Stallenwerk?
Maybe make a note. It says here if everyone acted like normal. So if we kept going to school, going to work, going out in big groups, the number of cases would increase of the COVID-19.
Okay, so if we keep going places in big groups, the number of sick people would increase. Okay. But are we really headed for that many cases? Yes. So what do we do to prevent disaster? We have to flatten the curve. And fortunately, people are listening. Clearly, public officials and businesses are listening to the warnings of public health officials. This shows in all the closings and cancellations. But to be affected, ordinary people need to do their part by avoiding as much as possible any crowds in places where large numbers of people congregate. This includes movie theaters, malls, and events that haven't yet been canceled. Anything you would say about this?
We kind of wrap that up. I think they're kind of really stressing that these closing and cancellations are important, but in ordinary to be effective, people really have to abide by them and do their part.
Okay.
So washing your hands, keeping in smaller groups, staying away from those big crowds.
So everyone needs to do their part in helping prevent the spread.
And flatten the curve.
And flatten the curve. All right, friends. So now your assignment is to go to the quiz. Do your very, very best. I bet you money most of you will get a 4 out of 4 on this. But that's definitely your goal. If it's, oh, I'm showing you the correct answer on that one. Maybe you didn't catch that because you were looking over at your brother or sister or something. You definitely didn't see that. Yep. So good luck on the quiz, guys. And for today, this does count as your Newsela article. So look for that book club prompt and your homework.
All right, 5th graders, so after you finish that quiz, make sure you continue reading your book club book and keep working on session 2 of your homework, which is thinking about where and how you learn new information. So think about conversations, what your characters are learning. Make some notes of that in your Google Doc that your teacher has shared with you for your book club books, your book club groups. Also, don't forget to keep working on your reading log. Get that initialed by your parents. And remember, this is reading that is in addition to your book club book. So your book club book is schoolwork. The yellow reading log is like your homework. All right.
Have a great weekend, guys.